When you have the diagnosis, you know there's nothing else to do but go forward and try to treat it. In your
Yeah.
situation, there was a choice. So maybe you could give us a little
Yeah.
bit of that story to bring us there.
Yeah, absolutely. I mean, it's definitely because I still haven't really had to deal with a cancer diagnosis, which is interesting. So, and
Mhm.
I'll talk more about that too. I think the difference is something that we already kind of mentioned a little bit is like that anticipation and anxiety. Um, and there is something about the reality of the situation kind of settling in, and quick too. Like you're facing the clock when you're diagnosed with cancer. You're still facing the clock when you have a cancer gene too, but in a different way. So I think it's just a matter of like anticipatory grief and how much of it you're going to face. And so, and the difference is to not having to deal with all of the cancer treatments. And so like when you have the cancer gene stuff, it's more like, okay, you're facing a lot of risk reducing procedures and things like that. And it's
Yes.
that's hard for some people too. I mean, it's not even like, okay, some people don't even want to think about that or deal with it or do those things.
Well,
Um,
right. That's what I was thinking.
yeah, but when you're diagnosed with it, it's almost kind of like you have to,
Right.
like you're not, you really, your choices are, uh, what type of suffering do you
Yes.
want to take on,
Yeah.
or death. So it's just kind of like a you're facing the clock and your own mortality much quicker.
Yeah.
I
You
think.
you don't
I
you
think
have
that's the difference.
yeah.
To
You
answer your question, that's kind of like it's time. I
right.
think, or
I,
and what you have to take on right away, right? Like, are you going to be having to do like radiation treatments, chemotherapy?
right.
Um, are you going to try like a new trial drug, to see if that helps? Are you
Mhm.
going to be doing a lot of the surgeries?
Yes.
So, and then
Yeah.
there's the fear of it coming back, and how long will you be in remission, and will these things work, and what type of cancer is it? Because there's so many different types, and every type of cancer will be different in how it's approached.
Right.
Um, and you're given that whole like time frame too, like this you have so many years, if it's like, and then what stage, the way
Yeah.
they're staged. Um, so yeah, that's I think the difference there. I can't
Yeah.
really personally speak to getting diagnosed with cancer, but definitely the anticipatory, I think, anxiety that comes with knowing that you're very well could get cancer,
Yes. Right.
and yeah, some pretty bad types. So um, and
When
then more and more, I've realized like it's talking with other people, women, and these support groups and things like that. It's not really like a matter of if, because the people, it's a lot of the folks that didn't do anything or chose to kind of be like, oh, okay, well, I'm good. I don't have cancer now, so um, and don't have a family history. So like a lot of these women have watched and seen like their relatives pass away early on from cancer. And so I've come to realize too, like it wasn't a problem of like if, it's when. So there's that aspect to having a cancer gene too. It's not really, um, if you're gonna get cancer, you're probably gonna get some form. There's an umbrella, right, for
right.
certain cancer genes, um, and so it's not really you're really kind of like gambling with your life if you decide to not do anything about it.
Yeah,
Um,
exactly. And the time part when you don't have it, I would think could really mess you up a little bit
mhm.
because yes, there's time, but it could be years, right? And so like,
Yeah.
what's the risk factor there? How much do I play with that risk factor? How did
Hmm.
you come to the decision? Well, let's start right, well, at the beginning. Like, when did you find out about the gene, and maybe how long was the process for you in going through to make that decision?
I found out in the beginning of 2021. So, gosh, that was like 3 years ago now. And it was kind of an accident, which is it in itself kind of a lot,
Hmm.
if you're not expecting it, because I didn't really, I, I think everyone kind of has like an extended family history of cancers here and there.
Yes.
But none of my immediate family members or women in the family had breast or ovarian cancer.
Okay.
And then little to nothing was known about my dad's side. So he just didn't know. He was just like, yeah, I think my grandma had some kind of cancer. I don't know.
Hmm.
They just didn't really talk about health issues
Right.
in his family. So
Okay.
um, yeah, so none of my immediate family, none of the women in the family.
Hmm.
My dad had melanoma, bad skin cancer. Um,
Okay.
and he always is getting things cut off of his skin. And he spent a lot of time in his youth in the sun, being from the Bay Area. And I found out through requesting, I kind of was at a point where I was just trying to figure out my health generally. I wanted to know if I had some other inherited things. So, like a
Oh,
connective tissue disorder that my mom has. And so I'm
okay.
like, well, in Nevada too, there was nothing available. No genetic testing for adults. There was one pediatric genetic counselor or
Hmm.
geneticist. I shouldn't say
Right.
genetic counselor, that's different.
Right.
But I just was like, my primary eventually was like, you can just order one of those consumer tests. And that's all, that's what you can do,
Yeah.
like take it into your own hands. And I'm like, okay, well, those are kind of expensive. But I did find a deal at the time on this one company had, like you can sequence your entire genome for half the price right now. And I was like, okay.
50%.
And since they weren't 23andMe and not selling people's data, I was like, okay, like I'll try this one. This one seems to respect privacy and medical data. So I like that.
It's
So I
important.
requested a test, took some time, got the results back in a really like cool, convenient portal, right? It was just a swab. I sent it in and they gave a lot of like information regarding not so much ancestry. This wasn't an ancestry one. These were like all health related, right? And it was my entire genome sequence. So they give you your raw data and then they give you kind of like a their reports. And so they were in the form of like something called a polygenic score, and it showed me like, hey, what are you most kind of at risk for based on your polygenic score and your genetic mutations. And so I kept seeing just over and over again, or way up high, were like some things that I kind of suspected. I'm like, okay, that's weird. Um, some contradictory things, and then breast cancer, and I'm like, what? And ovarian, and I'm like, what's this about? Like, why am I at such high risk for breast cancer?
Right.
And so I just kind of like poured over my data, and again, they give you, before you even go into the portal to access your results, they give you a warning. They're like, this can be psychologically distressing, to see these things about yourself. Please make sure you like consult a doctor maybe or somebody to like help you process some of these things. And so I was like, okay, screw it. And I like closed it
Really.
and then was
Let me
like,
alone. And you're like, whatever.
yeah, and I just wanted to see what was going on. And so what I did
Amazing.
was I took a look at like what are some common genes that are associated with a high risk for breast cancer, because this keeps coming up. And all types of breast cancer too. It was like triple negative, HER2, I'm like, what is this? And so, of course, the BRCA genes come up, and there's multiple cancer-related genes.
Right.
And so that came up, and I saw, and the raw data is really interesting too. Like it's just a bunch of symbols, and like it shows your entire gene kind of like on a line or on a graph, and then where your specific mutations are located. So I pulled up the BRCA1 gene and all the genes associated with high risk of breast cancer, and then saw
Right.
like, okay, I there is a bright red like pathogenic mutation on the BRCA gene, and I'm like, what's that mean? And so I look
Mhm.
into it, and it was my only like truly well-known pathogenic mutation, and that means something is wrong, something is not well known wrong. So there's a ton of them. They're like unknown variant, you know on all these other genes. And
Okay.
so I pull it up, and it's like, oh, this is pathogenic, this is indicative of hereditary breast and ovarian cancer syndrome. um, And so then I was like, okay, we'll see, what is that, And so then
Yeah.
the person to contact for that is a genetic counselor. So because I brought that to my primary doctor. I was like, hey, I got that test and it got the results that you wanted me, but this came up. So what do I do about that? And she's like, oh, so you need to go see a genetic counselor to help kind of confirm these results
Okay.
because and so took it to her, this awesome doctor in Vegas, awesome genetic counselor, and she was like, "Oh," she's like, "This is interesting." She's like, "I've
Yeah.
only had one other person bring me a consumer test
Really?
to confirm results, and we did confirm his results too. But let's just see." So
Yeah.
they order like a cancer gene panel, and that's just a blood test, and it came back. So BRCA1, uh, pathogenic mutation. Bad one too. So, and
Really?
she gave me like, it's like this packet of like, what does my exact mutation mean? Where does it come from? So sometimes you'll hear like BRCA genes have a high relation to Ashkenazi Jews, right? Like if you're Ashkenazi Jew, you automatically get tested for these BRCA mutations because there's such a high prevalence in that population.
Right.
But I'm not. So it said it was an Irish founder mutation, right? So
Oh, wow.
that's my origin. So you find out a little bit about your ancestry too. And it basically told me in everyone's, it's kind of a range of like 30% to 70% lifetime risk for breast, ovarian, and a bunch of other cancers. And so it was 68% lifetime risk for breast and ovarian. That's
Holy cow.
high. That's
Very
really
high.
high.
That's,
So
yeah.
why my particular mutation is so bad is because it's sometimes you'll get something called SNPs and they kind of like mess up your code, but this was just something called a stop codon where it shouldn't have been. So like it just stops the gene from working.
Hmm.
Um and so I think when people think of like cancer genes, they think, are these bad genes? No gene is bad or good. It's just it does what it's supposed to do. And so the BRCA genes are cancer suppressing, or sorry, tumor suppressing genes.
Mhm.
And so when they don't work right, they don't suppress tumors,
Right.
right? Or like out of control cell growth. And so when there's the code that's written to do that just isn't there anymore, that's what a pathogenic mutation is, right? Like certainly, okay, it's not going to work. It's just not
Right.
going to do its job.
Mhm.
And I don't know why it's those particular cancers, and I kind of haven't really found any answers either for why BRCA genes are responsible for suppressing tumors in your reproductive system,
Okay.
or your skin, or things like that, but they just are. So I think there's still more research to be done
To be
on
learned, right? Yeah.
why on those genes. But maybe CRISPR can help with that. I don't know. But
Can I just ask you the BRCA1 and the BRCA2? Where's the difference there?
the only difference I've kind of heard is that BRCA1 mutations are more severe or
Okay.
put you at higher risk than BRCA2.
Okay.
Some women have both, or some people have both
Hmm.
mutations on both. I only have a mutation on BRCA1. So um, that's,
That's
yeah, kind
enough.
of the difference
Yeah.
I've heard. I'm not quite entirely sure myself.
Okay. That's
Um,
fine. That's fine. I was
but
curious if you had any insight into it. But
yeah,
I mean, BRCA1, it's the worst, and this is now what you had to deal with.
yeah.
How?
So I got the diagnosis that way. And then my counselor was amazing. Like she walked me through what all that meant, what's going to happen next, and gave me like a very clear timeline.
Okay.
Because they were able, it's amazing. Science is amazing. They were able to calculate my exact risk
Yeah.
and lifetime risk. And it's interesting how lifetime risk is calculated.
Okay.
Because it's not just like you have 68% chance now, it's more exponential. Like as I age, it
Sure.
will be exponentially more um, likely that I get these cancers
Okay.
with that type of prevalence. Now, the normal population, I think, breast cancer in women, just normal average sample size. Gosh, it was kind of high. It was like I think 13% or something. But ovarian is much more rare, so it was I think 0.5, whereas mine is 68. So
For
that's
both, for
it's a
both.
high risk. Yeah. So it's and that's lifetime risk when you
Yes,
see those
right.
percentages and stuff like that.
Which
So
then, as you say, as you age, would increase.
yeah, it increases exponentially as you age. Um, so you have a 68% chance in your lifetime of getting
Yes.
one of those.
I have so many questions about just the discovery and you personally and how you
Mm-hmm,
responded to it initially and how you began to cope with it.
mm-hmm.
So because it's not the news anyone wants to hear, and so
Yeah, no. It came out of nowhere too, and I was like, "Well, what the like why? Um
yeah,
what there's no family history. Like where did this come from?" And so then of course, after that finding that out, both parents and immediate family is recommended to get tested.
okay,
Um so, my dad went and got tested. Um he had it.
really,
It doesn't usually you think, oh, blame the women, right, in the family. Nope, mom is fine. Like it was my dad that had it, that has the mutation, and he just didn't know. That entire side of the family was a big question mark. So
your mom
I wouldn't have
does now.
known if I didn't get this test,
Yes, and your
kind of
mom,
thing.
nothing on
Yeah.
your mom's side as far as the bra.
Nope, not for BRCA mutations.
Incredible.
Nope. And so
Yeah,
then around this time too, I was talking to my sister, and I was like, okay, this happened, get tested. She was fine.
yeah,
And
she
that's my
was.
dad's kid, so
Okay.
she was okay. But
Hmm.
yeah, when you have one parent, that's a 50% chance of
Yeah,
passing it down.
there you go.
um
So,
yeah.
what was the initial reaction for yourself? What went through your mind when you saw it?
uh
Because it depends, everybody's personalities of the individual, right? And how they
mm-hmm.
life and what they've been through. So,
So my reconstructive process was um having first I had tissue expanders. um and those are kind of like they're an implant, but they stretch your skin. um and then just kind of they're placeholders, right? And then
yes.
they have these like drains on them too. So post surgery I had drain bags and everything. um and those were gross. And so
Mhm.
that's my least favorite part were the drains and
Oh my
having
goodness.
that. Yeah. It was gross. And
How long did you have to deal with that?
let's see, probably I got those out, I think in I want to say 3 or 4 weeks.
Okay.
And I might be wrong. I was so out of it.
Yeah. Yeah.
And it's yeah, I had an amazing support system. So it was my
Yeah,
mom and my
I want to talk
partner
about that. No,
taking care of me entirely. And like yeah, for 6 weeks I just did nothing. Um
your mom and your partner, because I know when I speak,
yeah.
sometimes I overspeak and then I miss what you say in the recordings.
Yeah,
I want people
yeah.
to know your mom and your partner were your support system.
Yeah, yeah. And so my partner was the one like you have to strip drain tubes and milk them and then measure your output and everything. And I
Okay.
had my mom got me a little pouch to put them in to walk around.
Oh,
Um and they recommend that you ambulate as soon as possible, but I was on just a litany of medications and
yeah.
drugs, and those were hard too. Like I hated a lot of the medications I was put on at first because they made me feel so. But the pain is bad, um, at first if you're not on all
Yeah,
that
they
stuff.
have
And yeah.
yeah.
um,
Side effects, they're horrible. They suck.
yeah, some of the side effects I stopped some of them earlier than prescribed just because I was like, ugh, I don't like this.
Oh,
Um,
man.
so yeah, and after the tissue expanders, those stayed in a little bit longer, some months after, and then I've scheduled the reconstructive surgery. So that was this past May, and
How many
that's
months
where they
was
do the switcheroo. So they swap uh your tissue expanders for implants if you're
okay?
if you're doing. Some women opt to do it direct to implant, which I don't know. I again just looking at sometimes support groups are hard. You
Hmm.
just like you feel like okay, this is what everyone's going through, but my god, I cannot look at another pair of like disfigured tits anymore, like or bruising or like any of this. It's
Yeah.
not making me feel better at all. It's not reassuring to see some of
Yes.
the mishaps and things that, and bad botched surgeries
Right.
that
Is
people
there an
go through,
increase in potential botch surgery when they go direct? When
yeah,
you go direct? Okay.
because you
You're
might
not,
reject it.
your skin
You're
or
not stretched either. Your
that's not.
skin needs to stretch, and
Mhm.
it's better to do it over time
Yeah.
than just shoving them in there and then expecting,
Oof.
and then not being properly sized and everything. So it's just like,
Oh
yeah, I
man.
didn't want to do that. I was like, no, let
No.
the tissue expanders also sound awful, but they're at least over a period of time. And this
Gradual.
is like the most, detailed kind of gradual way to do this,
Yes.
to not
Yes.
traumatize the skin or cause, yeah, any bleeding. Yeah. Yeah.
Right.
So it's just like there's always risk of like, yeah, clots, throwing clots and things like that too. And that was scary for the second one. Because I did have some fat transfer too. So my reconstruction was fat transfer
You
from my
did.
stomach. So I had lipo.
Oh
And
wow.
that's part of it too. You're just like, you don't realize like how much goes into these procedures.
Yeah.
So I had a little lipo needle in there, and that I'm still sore like from that. Like
Really.
that was more sore than like my chest.
Wow. Like
So
4 months
if
later.
you ever want lipo, like watch out
Give it,
because
no.
that shit hurts. Like
Oh my God.
yeah, like your stomach just hurts. And I'm
I
still
can
like
only
kind of sore to
imagine.
the
I
touch,
can
and you get
imagine.
lumpy and like, so but what she wanted to do was like, have both. She like implants and then some like fat, my own fat in my chest. And so to make it look more natural.
We're natural. Okay.
So it's good. It's so important to find a good plastic surgeon too that's ethical, because a lot of them are not. So they'll just kind of say like, what size do you want? And then like they won't dissuade you from going bigger. So they're
Bigger.
like,
Yeah.
this is realistically what you can do, like
Right.
without adding too much more trauma to your body, because yeah.
How did you know? How did you know that this was the right person?
um just based on just former like reviews, what other people were saying, and then just how she was just very reassuring and thorough. So she
Oh,
knew her stuff. Like she
okay.
could answer all of my questions in a way that she was confident. She was like, you can, she's like, okay, what size do you want? And I told her, and she's like, no, you have to do within this range, or else that causes such and such and such. And so she wasn't trying to like upsell me or like do more procedures. She was just kind of looking for, to make it as efficient as possible, while also still like making making something beautiful, right? Like she's very, but she's also cares about her patient's health.
Yeah.
It's
Yes.
not just aesthetics, because yeah, a lot of plastics like love money and aesthetics, and so, but they
Sure.
don't consider. And then she explained to me, she's like, well, if you go this route, implants they last about, I have warranty on my implants. I got like a warranty card, and
Yeah.
they're like, so funny. And then she's like, they last about, 20 years if you go like silicone. We also have saline, and here's the difference between the two. Also,
Yeah.
like, it was kind of like, yeah, it was cool in a way, to like create your own like
Yeah.
chest. Like, I want this shape, and like
That's
let's
pretty
do
wild.
silicone, and because they last longer, and there's no more associated risk, and they leak less. I don't know, and things can go wrong. They inform you of everything that can probably go wrong,
Yeah.
if even if it's rare. But things can go terribly wrong with these
Sure.
procedures, but luckily it's like they were just there.
Mm.
This team too like saw me through my whole reconstructive process, from like doing the drain. They took out the drains.
Mm.
They did some gnarly stuff, and so like they did, yeah. And it was just so like, I don't know, it was really cool. It was cool to have that same team for like months and months and months, and just like, you know
Yeah.
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 And they all have implants too, like whether
They
they've
really.
had, and they don't, not all of them had like breast cancer, but like they just
Mhm.
know what you're
Yeah.
going through. You're just like, yeah, this sucks, I had these drain tubes too. Or like, yeah.
Yeah. I mean, I think
Lipo's the worst. You're like, yeah.
yeah, I think it's, to have a consistent team, you're working towards this goal together. I think that's
Yeah, it
important.
very
Yeah.
much felt collaborative,
Yeah.
like they're on your side, you know.
Yes.
they care about your well-being.
It
Um,
literally is a team
yeah,
up.
and that sounds like baseline stuff, but it can be hard to find
Oh my gosh,
in
absolutely. Like you said, there's a
in
lot of
our
shysters out
healthcare,
there. There's a
you
lot of
know?
shysters out there too that are just looking to make a buck. And
Yeah.
yeah,
Yeah.
so it sounds like a couple of things. Number one, sounds like you were really smart in how you went about researching and finding the right people and making the choices that you made. That seemed certainly having the skin being stretched over time just
Mhm.
sounds so it just sounds right, to me.
Yeah.
But also in the manner in which you were handling the entire situation. Did you start to kind of relax as you were going along, or was each step filled with the
Mhm.
same kind of anxious anticipation, or was there?
Yeah.
Yeah, could you talk about that a little bit?
Yeah.